Good day, ladies and gentlemen. Can anyone guess my name? Anyone? I know, it's hard to guess, right? Before I start, I want everyone to know that I have two personalities. And we have decided that I will go first and she will manifest and switch places with me later on. Okay? My name is Dinoprostone. That's my generic name. My brand name here found in the Philippines is Primogen. My chemical name is 11-alpha 15S dihydroxy 9 oxoprosta 5Z 13E DN1 oic acid. My therapeutic drug classification is oxytocic. Oxytocic is when it accelerates childbirth by stimulating uterine contraction. My pharmacologic drug classifications are abortifacient and prostaglandin. Abortifacient is when it induces and causes abortion, and prostaglandin is when it stimulates the muscles of the uterus and affect the blood vessels. It is also used to induce abortion or birth. I know you are asking if I'm safe for pregnant women. My pregnancy category is C. When we say pregnancy category C, it most likely cannot be prescribed by a healthcare provider because it may cause harm to the unborn baby. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of drugs in pregnant women despite the potential risk. Hey guys, want to know more about me? Is that a yes or a no? Okay, I'll take that as a yes. Now, let's talk about my mechanism of action. I am equivalent to prostaglandin E2, or what we call as PGE2. I stimulate labor and delivery by stimulating the uterine. That results in termination of pregnancy. I'm also capable of stimulating the smooth muscle of the gastrointestinal tract of man. This mechanism of action may be responsible for vomiting and diarrhea, which is not uncommon when I am used to terminate pregnancy. Now, let's talk about my pharmacokinetics. Firstly, let's talk about my absorption. When using vaginal suppository, it takes quite some time, about 2 to 3 hours, because it is slowly absorbed. When using cervical gel, time to peak plasma concentration takes about 30 to 45 minutes. Next, we'll discuss about my distribution. In my distribution, it is rapid when I am distributed intravenously. I am diffused into the maternal blood and can enter the breast milk. I could also cross the placenta. Now, let's talk about how I am metabolized. I am metabolized in the lungs. I form metabolites which are further metabolized in the liver and the kidney. When it comes to excretion, I am excreted through urine. And also, I am excreted to small amount of feces. Now, I'm done with my discussion. My other self or other personality keeps on yelling at me to stop already and let her take over. Well, we did make an agreement, and she will switch with me in a few moments now. Thanks for listening, everyone. She will now take over the discussion and you will furthermore know about us.
Yay! Finally! Hi, I'm Dinoprostone. Yes, the other half he was talking about. And I'm going to continue the discussion from here on out. So bear with me. I am going to show you our indications. Since we are not an ordinary drug, indications are needed for using us. Indications are a valid reason for the use of a drug. In our case, that includes the termination of pregnancy and the cervical ripening prior to delivery at term. On the other hand, I am contraindicated to people with allergy to prostaglandin preparations, people with acute pelvic inflammatory disease, people with active cardiac, hepatic, pulmonary, and renal disease, and women with prolonged uterine contractions. I am also contraindicated to patients with unexplained bleeding during pregnancy. I also must be used cautiously to patients with history of asthma, seizure disorders, anemia, diabetes, hypertension or hypotension, jaundice, scarred uterus, cervicitis, acute vaginitis, and CV, renal or hepatic disease, and glaucoma. People might get adverse and side effects from using us. Well, we're sorry, we get a little carried away sometimes. From the cardiovascular system, we cause fast or slow heartbeat, pressing or painful feeling in the chest, and weak or absent pulse in the arms or legs. For the integumentary system, we can possibly cause hives, pale, cool, blotchy skin on arms or legs, flushing, chills or shivering, skin discoloration, and diaphoresis. I told you, we can get a little carried away sometimes, so before you use us, make sure that you need us. Oh, and that's not all. We also have side effects on the respiratory system. We cause shortness of breath or trouble in breathing and wheezing. We also have side effects on the digestive system. This includes abdominal or stomach cramps, diarrhea, vomiting, constipation, and tender or mildly bloated abdomen or stomach. Next is our possible side effects for the reproductive system. This includes increased pain of the uterus, swelling in the genital area in the vulva, unusual increase in bleeding of the uterus, foul smelling vaginal discharge, breast tenderness, urinary retention, and vaginal pain. We also have adverse and side effects for the special senses. We can possibly cause swelling of face inside the nose and eyelids, a blurred vision, eye pain, and auditory impairment. You see, we can be a little bit of a hassle. For the systemic response, you can possibly experience a fever, nausea, and a localized warm feeling. We also have side effects for the neuromuscular and skeletal system. This includes back pain, leg cramps, muscle cramps, tremor, and weakness. Now we're on to nursing responsibilities for our drug use. Before administering us, you should make sure that the patient is in supine in the dorsal position and should remain supine for 15 to 30 minutes following administration. You should also monitor the vital signs. When used for termination of pregnancy, do not use if fetus has reached the stage of viability. That can cause further harm to the mother. Use caution with history of hypotension, hypertension, cardiovascular disease, anemia, jaundice, diabetes, compromised uteri, cervicitis, endocervical infections, or acute vaginitis. Vaginal gel is for intravaginal use only and not for intracervical use. You see, you should be careful in handling us. We are not an easy drug, and our effects on the body are not that light. Nursing responsibilities before administration also vary on the type of dinoprostone you will use or what is suitable for you. For endocervical gel, you should bring to room temperature prior to use, and you should not force the warming process such as heating. And you should also avoid contact with skin. For vaginal insert, keep drug frozen until use, and the product does not need to be warmed before use. You should not open the vaginal insert with sharp objects. This may compromise the knitted polyester pouch, which is the retrieval system for the polymeric slab. And lastly, you should not use the vaginal insert without a retrieval system. During administration, it is important to remember that you should monitor the vital signs and you should always avoid contact of us to the skin of the patient. Because we are available in many forms, the nursing responsibilities during administration also vary. For tablet, you should administer it with a small amount of water, and you should also monitor the uterine activity. For the vaginal gel, you should monitor the fetal heart rate, the uterine activity, progression of cervical dilation and effacement, and signs of amniotic fluid embolism. You should place the vaginal gel in the posterior fornix, and the patient should remain in supine position for 30 minutes to prevent leakage. For vaginal insert, the patient should remain in the recumbent position for 2 hours after insertion. And you should monitor fetal heart rate, uterine activity, progression of cervical dilation and effacement, and signs of amniotic fluid embolism. Because of her heavy effects on the body, it is not advisable for people to self-medicate with dinoprostone. After our administration, the nursing responsibilities include waiting 6 to 12 hours after administration before initiating oxytocin. As per usual, syringe is for single use only, and proper disposal should be observed. Also, the use of oxytocin should be avoided for 12 to 24 hours after administration of vaginal gel. Because we are available in many forms, nursing responsibilities after drug administration may also differ. For the vaginal insert, you should ensure complete removal of system at the completion of therapy. Oxytocin initiation after vaginal insert takes shorter than usual. You can wait for 30 minutes or more before initiating oxytocin. For vaginal insert, it must be removed prior to administration of oxytocin, and do not forget to remove it completely. And that sums up our get to know video. Wow, we're done. Thanks for watching. I hope you had a lot of fun with us because we had a lot of fun with you. See you next time.